Jai Hind, dear children. Welcome to today's Social Science online class. Today, we will continue chapter 2nd, that is, Role of the Government in Health. Children, are you remembering what we have discussed in the last class? Yes. In the last class, we have discussed about what is health, then the factors that influence the health, and also healthcare system in India. Isn't it? Children, now we are going to discuss about healthcare services. There are two types of healthcare services. The first one is public health services, then the another one is private health services. So let's start with the topic public health services. Children, what is public healthcare service? Public healthcare service is a network of health centers and hospitals run by the government. These public health services are found both in rural areas and urban areas. At the village level, health centers are there, where there is usually a nurse and village health worker is available. So, the nurse and health worker in the health center is trained in dealing with common illness and they work under the supervision of doctors at the primary health center. That is PHC. PHC means Primary Health Center. So, the primary health center covers many villages in rural areas. At the district level, the district hospital supervises all the health centers. Large cities have many general and specialized government hospitals. Public healthcare system is much affordable as they provide services either free of cost or at a very low cost. Due to the affordability of our government hospitals, there is high rush in the OPD. OPD is the outpatient department. OPD is the department where the patient is primarily seen, then if need arises, he or she is shifted to the ward. Children, when is the health service called public? The health service is called public because it has to provide quality health care to all the citizens. That is, public as a whole. Then the government also builds health centers and hospitals for general people. Then the government appoints doctors, nurses, technicians to serve at the health centers to provide health services to the public. And also, because the public health services get their fund from the taxes paid by the people. So, it is the responsibility of the government to provide healthcare facilities to all. The next is about the important functions of public healthcare system. Public healthcare system is to provide quality healthcare services either free or at a low cost. So, even the poor can seek treatment. Another important function of public healthcare service is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, etc. So, this has to be organized by the government with the participation of the people. It also ensures free supply of medicine. So, children, in what ways the public health system meant for everyone? So, let's see. According to our constitution, it is the primary duty of the government to provide healthcare facilities to all. So, the government must safeguard the right to life of every person. The court also said that it was the duty of the government to provide the necessary health services, including treatment in emergency situation. So, the hospitals and medical staff must fulfill their duty of providing the necessary treatment. So, public is an activity or service that is meant for all people in the country and is mainly organized by the government. This includes schools, hospitals, telephone services, etc. So, people can demand these services and also raise questions about these services are not functioning. Understood? Children, the next one is private health facilities. An activity or service that is organized by an individual or company for their own profit. Private healthcare systems which are privately owned and not controlled by the government. Large number of private healthcare services exist in our country, as large number of doctors run their own private clinics. In rural areas, registered medical practitioners are called RMBs are found. In urban area also have a large number of doctors, many of them providing specialized service. In urban areas also having large number of hospitals and nursing homes that are privately owned and not run by the government. And also there are many laboratories also provide special facilities like X-ray, ultrasound and medical shops also, from where we can buy medicines. Unlike the public healthcare services in private hospitals, patients have to pay a lot of money for their treatment. Today, in our country, private services are increasing. There are large companies that run hospitals and some are engaged in manufacturing and selling medicines. Medical shops are found in every corner of the country. So, children, the private health services are run for their own profit. But it provides good care. It also provides good facilities. Many doctors are specialized in various departments. But private health service provide high cost of treatment. It is also concentrated in urban areas. The cost of these services are very high. So the poor people cannot afford it. Understood? The next is about healthcare and equality. Children, is adequate healthcare available to all? Means all people get the treatment for illness? No. So children, how can you say that adequate healthcare is not available to all? We can say without any doubt that adequate healthcare is not available to all in our country. The main reason is that the private health services are increasing, but the public services are not. Then the private services are concentrated in urban areas and the cost of service is high and medicines are expensive. So the private health facilities are not for all the people. So the poor people hardly afford them whenever there is illness in the family. So adequate healthcare is not available to all in the country. Only 20% of the population can afford all the medicines that they require during illness. It has been found that 40% of the people who are admitted to a hospital for some illness have to borrow money at the time of illness. For the poor, every illness is a curse. As they are undernourished and live in unhygienic conditions, they frequently fall ill. The expenses on illness make the situation even worse. So, it is the responsibility of the government to provide quality healthcare services to all the citizens, especially the poor and the disadvantaged. So, children, in order to improve health situation of our people, what changes did the Kerala government make in the state in 1996? So, let's see. In 1996, Kerala government made some major changes in the state to improve the health condition of the people. In 1996, the Kerala government decided to give 40% of the state budget to panchayats. The state government directed the panchayats to make proper planning for water, food, women's development and education in each village. This means that water supply schemes were checked, working of schools and Anganwadis was ensured. Then health centers were improved. So the healthcare in Kerala stood first among all other states in India. Okay. The next is about what helped Costa Rica to become one of the healthiest country. Costa Rica is considered to be one of the healthiest countries in Central America. Many years ago, Costa Rica took a very important decision and decided not to have an army. The money so saved was expensed on health, education, and other basic needs of the people, such as safe drinking water, sanitation, nutrition, and housing to all its citizens. Understood?